好，欢迎来到杰西好 Talk， 我是杰西姐。那么这一集呢是来到良医详谈的第3集，讲有关于糖尿病的话题，终于来到尾声了。如果观众朋友们还没有看第1集和第2集的精彩内容的话，待会可以在以下的链接中回去看哦。这一集里面 Dr. Clement 为大家带来更加精彩、不容错过的内容，那是讲有关于糖尿病溃疡、糖尿病伤口。Dr. Clement 会详细讲解为什么糖尿病人那么容易会得到糖尿病伤口，然后还有一些非常简单的方法，可以让大家避免糖尿病的伤口恶化，然后可以避免自己要去到截肢的那个命运哦。对你来讲啦，如果你脚上有一个小伤口的话，你会怎么做？如果你没有糖尿病的话，通常我们都不理它吧，就是擦一些药水消毒一下，等它自己好就算了，是不是这样呢？其实我们大家都会想到伤口没什么大不了，但是对于糖友们来讲，那个故事不是这么说哦。如果是患有糖尿病，而且是长期的糖尿病的话，那个人的身体里面啊，他的血管还有就是神经系统，大多数都损坏的差不多了。如果他脚上有伤口的话，通常都很难会在第一时间里面会察觉，这样的话很大可能就会错过了那个黄金治疗时期哦，这个就很危险了。因为我看过这么多的真实案例里面呢，一些很小的伤口就发展到这么大的伤口呢，用到的时间才短短1-2个星期而已啊，这个要看那个糖尿病患者自身的健康状况和他的免疫情况了。所以千万不要小看那个伤口哦，通常从那个糖尿病伤口这么小去到这么大的话，去到医院，无论你是去到私人医院或者是政府医院都好，他们里面的医生呢一定会建议你没有其他的办法了，要把那个已经溃烂的地方一定要切掉，把那个的脚趾切掉，还是那个脚给切掉，没有办法。为什么呢？因为要防止那个细菌啊继续进到我们的血液里面，继续去影响其他的器官里面受到感染，而导致其他器官受损，然后就会导致健康的问题或者是生命的问题了。待会 Dr. Clement 会在影片的最后呢，会分享4个非常真实的临床案例哦，大家一定要把这个影片看到最后。它里面这些案例让我感到非常感动的是，这些案例你看下去呢，那些脚啊其实都好像没有得救了，每一个人看到都会觉得他们一定要把那个脚趾和那个脚给切掉，真的是没有得救了。但是这种溃烂的情况哦，Dr. Clement 可以把它救回去，把那个脚恢复到去那个原来的形状，好像从来都没有溃烂过的那一种形状哦。里面一些脚呢已经是溃烂的不成形啊，一堆烂肉，然后一些根啊筋啊，甚至是见到骨的那种，它竟然可以在短时间里面恢复到原状，事情就是那么神奇啊，活生生的摆在眼前。如果你感觉这个视频呢可以触动到你，让你感觉到它很有帮助的话，也把这个视频分享给更多你的亲戚好友们，分分钟你不但救人一脚啊，甚至是救人一命哦。还有在这边杰西姐要感恩大家的订阅和点赞，你们的支持是我制作视频最大的动力。那么接下来呢，这个视频中呢，它是以英语为媒介的，但是大家不必担心，杰西姐为大家准备了中文的字幕，所以大家可以安心的看。但是在这里，杰西姐要警告你一下，你要有心理准备哦，因为以下的内容啊，很多都是一些活生生血淋淋的案例哦，你看下去可能会感觉有一些不舒服，因为他们都是临床试验嘛，从这一个状况医疗好到那一个状况的，所以大家要有心理准备哦。好啦，话不多说，那么现在我们就来开始吧。
So after we talked about diabetes, so now it's time to look at the diabetic foot ulcer. So how diabetes cause diabetic foot ulcer is by a few mechanisms here. Sensory neuropathy. In my clinic, what I do is I use this standard tool used by international doctors internationally to touch on the sole of your feet. And when I touch on it, you do not feel anything. So I consider it as a loss of sensation. So this is how we test the sensation of the foot. So in sensory neuropathy, what actually happens is in a diabetic is there is no or reduced sensation on your feet. So when you kick on something, you do not feel the pain. And that's how we started a chronic wound on the diabetic foot ulcer. And then second thing is there is motor neuropathy. The muscle will become contracted or pulling it one way, making the foot abnormal, and then the fat pad on the sole of the foot is getting thinner, and then you may develop this condition called Charcot foot. It is an inflammation condition in the foot, and I will talk about it more later. Also, there is a autonomic neuropathy where the sweat gland and the oil gland was damaged by the diabetes, the disease process. So you end up with a very super dry feet because your sweat gland is not working anymore to produce the sweat or the oil to moisturize your skin. So you can see a lot of diabetic, they have dry, cracked skin on their feet. Okay, look at this picture, and what you can tell me from this picture. It is a lady's foot and feet, and nicely varnished. And what else can you see from this picture? If you are not a medical person, you may not see much, but let me educate you as a medical person and show you the diagram next to this picture. This lady have something called claw toes, hammer toes, curly toes, and this one as well. Okay, so this is an abnormal feet, and the toes are abnormal too because of the process caused by diabetes. You see, our feet are very strong and complex mechanical structure that contains 26 bones, 33 joints, and more than 100 muscles, tendons, and ligament. It forms a beautiful arch like this to distribute the weight nicely. Okay, but in diabetes, there is a condition called Charcot foot, where the small bones and the big bones collapse and then fracture and heal, recover, and then refracture, and making it like a very messy place, just like this collapsed bridge on the picture here. This is a normal x-ray of the foot, and if you look at the bone, they are not very nicely aligned. The densities are very even. The gap in between the bones are also quite regular. We call it a normal joint space, and then the tissue also are very healthy. And this is the other view. But if you look at the x-ray of the Charcot foot possessed by the diabetic person, you will see all the bones have different density. They are not nicely aligned. They are fractured, and then they heal, and then they are very messy. You just look at it in compared to the normal x-ray that I show you, you know already. As a diabetic, if you see something like this, the thick skin on your foot, it means you may already have some misalignment of the bones inside your foot. And this is the sign that you can see from outside, and that is on the skin. This is a thick skin, very hard, and it is formed because the bone is very near to this skin, and then when you walk, you keep rubbing on it, and then you develop this thick skin which we call callus. If you have callus, you're 77 times more likely to develop an ulcer on this spot or even under the skin without you seeing it. So when you are diabetic and you have these calluses on your feet, like this one, and this one here, you need to go and see a doctor immediately to have all these things removed and check if you actually already have a wound underneath or not. So let's look at some cases that we have treated in our clinic, and then and let's learn from them what we can do for this group of patients. The first case is a 60-year-old lady who come all the way from Teluk Intan, and her sugar level is about 8, HbA1c is about 8. There is a wound on one foot, and then she went to one private medical center in Ipoh to have, and then the surgeon there actually recommended her to have the foot amputated. Doctors only offer amputation to her, and I do not know if they are keen to treat a wound or not. Patient do not want to lose her foot, and the son wanted to save her leg. The reason why is because this is the only leg she has. The other foot has been amputated. So when she comes to see me in a hospital, this is what I did for her. This is the tissue on her heel that are dying. So the dead tissue actually need to be removed. So what I did was I performed a minor surgery to remove all the dead tissue so that the new tissue can grow up from the base of the healthy tissue. Okay, and then this is the second video. So you can see all the tissues are dying on the feet. So all those dead tissue need to be removed. If not, they will start to decay on the wound, and then the decaying dead tissues will become the food for the bacteria. So when we provide good wound care to the patient, this is essentially what we need to do. Cut away all the dead tissue so that they have no chance to decay on the wound and reduce the risk of bacterial infection. Okay, so this is the worst of her foot. Okay, after some times, as you can see, this toe is already dead, and you can see the tendon and also the bone in the center part of her foot. And then you look at the heel at this part, she has lost the fat pad, and also she has lost a significant amount of tissue. So from here, we started using vacuum dressing on her, and then from here it turns to here. And this picture is a few weeks later. In this picture, you cannot see the bone and the tendon anymore because the new tissue have grown over the bone and the tendon. So from here, it got better. And then as you can see, the tissues are red, and then there are more tissue covering and filling the wound. And then from here, it moves to here. The tissue have filled up the wound, and now the skin is the time for the skin to move in, and eventually this foot was fully healed. And this is her foot, and she was happily showing the picture of her foot to us, telling me that the foot has recovered. So this case was successfully treated, and then it was written up with a photo submitted to the Symposium of Advanced Wound Care in the US, and then the case was accepted by the committee, and I was invited to the US to present the case. Okay, in case 2, I have a 60 years old lady from Sanakan. She had a wound at the top of the 5th toes for a few months, and then later on she developed another wound at the bottom of the first wound. There was infection, and when I examined her, both are in communication. That means the first wound actually connect to the second wound. She was told by the surgeon to have it amputated, and the patient resisted the suggestion. So the doctor went online and managed to find me. And then the doctor, I remember she spoke to me on a Wednesday morning, and then on Thursday they already landed in my clinic here in Panasanway. So this is a picture taken by her daughter the night before they fly to KL to come to see me. So if they have not been able to see me, they would have gone for an amputation, and the surgeon would have made a big cut like this, and this part of the tissue, including the last toes, would have been gone. Okay, so in my clinic, when I saw her, I actually used a forceps to slowly push in from here, and the forceps actually came out this way. So there is a tunnel already. And what you can see from this picture is, you see this red area here, there is a definitely some infection. And then the whole foot was swollen, it was painful. Those are also the signs of infection. So what I did for her was, I did a minor surgery to drain off all the pus, and also I cleaned up all the dead tissue inside, and then I gave her antibiotic, and then we do daily good wound cleaning, and then the wound was actually making good progress even on the second day. As you can see, the wound is getting smaller here, and this is the bottom part, okay? And you can see the entire skin here are not red anymore after a few days of good antibiotic treatment. And then they stay here until Sunday, and then on the Sunday afternoon they fly back to Sandakan. So 2 weeks later they achieve full recovery, and this is how it looks like from the top, and this is from the bottom. So good wound care treatment for her has managed to save her this toe and this part of the foot from being amputated. Okay, this is the third case that I want to share with you. A Malay gentleman, 60 years old plus, referred by a cardiologist because of this piece of black and dead tissue on the heel. So what I did was, I actually did a minor surgery to remove this black patch and exposing this decaying, rotting tissue underneath. As you can see, it was very dirty. So we continue to clean it. And then this is the pictures of progression from here to here to here to here to here. And then to here, we are seeing more red, healthy tissue. And then from here to here to here, and then slowly progressing. And then the wound is getting smaller and smaller, and eventually the wound healed. And the fourth case is a bed sore or pressure sore. I'm sure you heard of bed sore or pressure sore, and how they usually happen is mostly it happens on stroke patient. When somebody has a stroke, they cannot move their body, so most of the time they're lying down on the bed, and if you do not turn their body frequent enough, then the part where they lie down most will start to break down and become a wound, and this is called pressure sore. So this is a 70-year-old lady. She has severe Parkinson disease, so she was bedbound, lying on the bed all the time on tube feeding. The eyes were not even open. But you see, when there is a person in the family who gets sick, the children are the one who have to take the burden, because they need to turn to take turn to bathe her, to wipe her, to clean her, to change her pampers, the diapers, and to feed her on the milk feeding NG tube. So a big burden for the family. This is how it looks like when I first went to the house of this patient, and this is the pressure sore. And then you see this black lubang here. This is a part where this yellow dead tissue has broken out, and then all the dirty pus are flowing out from here. And this is the back side, and this is the right buttock, and this is the left buttock. And pressure sore usually happen in this area. So after I did the minor operation, I removed all the dead tissue. I cleaned up the interior of this wound, and it was actually about the size of my fist, and that is the size. Okay, and after that, we treat the wound, and then tissue start to grow, and then as you can see, the tissue has already filled up the cavity, and then I think nearly 2 months later, it has become this big, this small, and eventually the wound finally healed. This is the last one of the case that I treated also, scalding by hot water. A lady banker, 30 years old, scalded by boiling soup 2 weeks ago. Went to see 4 different doctors in 4 different clinics in 4 different days, given 4 different sets of advice, and prescribed 4 different sets of dressing, but none of the treatment seems to work. So through the recommendation of friends to my clinic, this is how it looks like when she first arrived in my clinic. And then after I spent almost an hour cleaning it, it turned out to be much cleaner, and this is what we produce on her wound bed. And a few days later, the wound become better and cleaner. And then from here, we turn it into here. So the wound eventually healed in 12 days, although with some pigmentation, but at least it is totally healed. So we try to save every foot and every toes that comes into our clinic, but sometimes when patients come in too late, amputation is the only choice. But if it ever have to happen, then there are some supportive equipment that the patient can use to continue their life after that also. Okay, so I'm coming to the last few slides of my talk now, and I want to introduce to you the idea of a hyperbaric oxygen treatment. Not sure if any of you heard of this before, but hyperbaric oxygen treatment is common in Singapore, Australia, and other countries, big countries like US also. This is a hyperbaric chamber, and the patient go inside. We close and shut this door, and then we increase the pressure inside the chamber. And then once the pressure has reached a certain level, then we will start to ask the patient to breathe 100% oxygen. At certain pressure, when we give the 100% oxygen to the patient to breathe, we can increase the oxygen level of the patient inside their blood by 1,400%. So this is the level of oxygen that we can raise in your body if you are going through this kind of treatment. Why and who should go for this kind of treatment? We usually use the hyperbaric oxygen treatment to treat wound because one of the important component of chronic wound is hypoxia, which means the wound is lack of oxygen. So when we feed the wound with a lot of oxygen, what we can achieve is the high dose oxygen can stimulate the tissue to grow, and then the wound will grow faster and the wound will heal faster.
大家看完了以上这些案例，还有Dr. Clement 的详解之后，心里面有什么感想呢？可以把你们的感想写在下面的comment栏中，和 Jessie 姐和Dr. Clement 分享一下。在这里 ，Jessie 姐呼吁大家，你有没有患上糖尿病都好，轻的糖尿病还是严重糖尿病都好，都务必要把自己的血糖指数长期给它maintain的好好的，因为万一不maintain的话，10之8九啊，一定会去到最后就是截肢那个问题，要把那个脚趾和脚切掉，而且切的时候很大可能不只是切一个脚趾哦，它到最后啊会越来越严重，脚趾然后变成脚板，然后整个脚，然后就是整个腿都要切掉，切了一个脚不够，还可能去切2个脚。如果大家不相信的话呢，可以去医院看看，一大堆的糖尿病患者切了脚的都睡在那边，痛苦的望着你哦。这一些都是活生生的案例，我看过的，所以我觉得真的是对于健康来讲，大家一定要好好的去照顾。如果大家想要看更多的视频有关于如何照顾好糖尿病的饮食，糖尿病应该要吃些什么，不应该吃些什么，可以在Jessie姐以前所制作下来有关于糖尿病照顾的视频中呢，去寻找你们要的答案哦。在这里，Jessie姐祝福大家糖尿病控制得好好，血糖控制得好好，大家都身体健康。好啦，谢谢你的观看，那么我们下期再见 ，See you。